Hello, my name is Melissa Tomei, and this is my veterinary science trifold. My trifold is on joint injections in horses. I'd like to start by introducing myself. I'm 16 years old, and I will be a junior at Brandon High School in September. I own two horses named Jetta and Spike, and compete with both of them, and have competing in Oakland County Fair for about 5 years. Now the reason I'm interested in joint injections in horses is one of my horses got injections in the spring, and I didn't really know that much about them, and I wanted to educate myself more and learn about how this helped my horse and why he needed them. So I'd like to explain injections for you. The purpose of them is to relieve pain in horses. When horses go through a lot of torque and a lot of pressure on their joints, they begin to lose their synovial fluid. Now, synovial fluid covers the joints, and it kind of embraces the shock, and it slows friction down and lubricates them like grease on a joint. But when they go through a lot of damage in the joint, that synovial fluid becomes watery, and that is not effective. And then the joint becomes inflamed, and cartilage begins rubbing on cartilage, which is painful for a horse. So what injections do is they begin to kind of repair the cartilage, they reduce inflammation, and they help to regrow the synovial fluid and make it more rubbery like it should be. Now, as I just covered, pain occurs because of the loss of synovial fluid. And that is why cartilage is rubbing on each other, and that causes inflammation. And as you get more and more inflammation in a horse, it begins to worsen. And at that point, it can't get better without medical attention. So there are a couple different things that veterinarians can put into the joint. They can put in a corticosteroid, which is mostly a pain relief and reduces swelling. And there's two different types of steroids. They can have short-term relief, which you'll see results in about 12 hours, but those results don't last very long. And this is beneficial for a horse if they're at a competition and they're very sore and you have to go into that competition in a few hours and need to go. Now, there's long-acting steroids where if you know your horse has been having pain, and let's say you're going to be competing in a week or so, you can do a long-acting steroid, and these release pain relief like a time capsule drug. And you'll see joint relief for many, many days, a lot longer than the short-acting ones. Now they can also put sodium hyaluronate or hyaluronic acid into a joint, and this is what really helps the synovial fluid. It pretty much regrows and helps it become rubbery again. And they can also put antibiotics. Most vets like to put antibiotics into a joint along with the steroid or the hyaluronic acid to prevent for bacteria, because whenever you're injecting a joint, it becomes a breeding ground for bacteria if not sterilized correctly. Now, most vets like to do a combination of maybe the steroids, the hyaluronic acid, and antibiotics. You can mix and match, kind of. So the procedure when a vet does a pack injection or any other type of injection is they'll first cleanse the area. That's the most important thing, and the longest part of the procedure is cleaning the area. You need to clean it with warm water and soap, and then with cotton balls or a rag, clean rag, and alcohol. And then the vet will put on sterile rubber gloves and use a sterile needle, and then they'll insert the needle into the joint. Now it sounds very painful, but the horse is restrained by either a twitch or a sedative, and that's very important that the horse is restrained, because it's not very painful, but if the horse moves around, they could go into the wrong joint in the knee or wherever. So once the vet inserts the needle, they'll then squeeze the synovial fluid out, because it's not helpful anymore. It's just watery and it needs to get out of there. It's just causing problems. So once they do that, then they'll put the syringe onto the needle with whatever medication they're inserting into the hack. They'll inject it into the joint, take it out, and cleanse the area one more time, and then that's your injection procedure. So it's fairly simple, but it's so helpful to horses. Now, there are a couple of pros and cons about injections. The main is the price. Injections can be very costly. You can be paying about $100 to $300 just for one joint. Now most of the time if a horse is having a problem, let's say in the left knee, the right knee is also going to be injected. So we usually inject 2 joints, that's about $600. Sometimes performance horses are sore in multiple spots, such as the ankle and their hock. That's about $1,000 there if you're injecting 4 joints, and you have a sedation fee and the vet call fee and any other drugs that need to be administered. So injections can easily cost over $1,000. But because of the amount of relief that it gives your horse and just the repair that it gives your horse's joints, that cost becomes relatively realistic with the amount that it helps your horse and the amount that you're helping. You could be spending $1,000 in Butte every single day doing that. So, but another scary thing that people are kind of wary about is there is the problem that there could be bacteria growing once you insert a needle into a joint. Whenever you put a needle into a joint, there is probability for infection, but if your vet is well practiced, follows the procedure correctly, and sterilizes often, then there won't be a problem, and especially if they use antibiotics. But there is always the wariness of infection. There's also been a couple times where horses react adversely to whatever's being put into them, whether it's an allergy, but those have been very minimal. So cost is a main problem with people not wanting to do injections. So aside from that, most of the time injections are very helpful, and the number of horses that has helped greatly outnumbers the times that it have been an injury. Most of the top performance horses that you're going to see in the Olympics coming up, just if you go to any big show, most of your winning horses have had some kind of injection and are better because of it and can compete for much, much longer. And you might be wondering if your horse needs injections. So here's how you know. If your horse is just a good horse, they compete, they're happy, and then one day you go out to compete and they're just not themselves, they're not backing straight, they're pinning their ears whenever they go to stop. Whenever you seem to be putting pressure on their joints, they're not happy. They're probably in pain, and they probably need injections. Now, there's a difference between pain and not being trained. If your horse has never backed straight, never been a good backer, and you're thinking, okay, he needs injections, that's probably not what's happened. He probably just hasn't been taught to back. But if you have a horse that usually will back straight, or will stop good, or doesn't pin its ears when using its hocks or any other joint, and something that's happening, your horse is in pain. And what may happen is he might need injections because of inflammation. The first thing we want to do once you notice pain is talk to your vet. Your vet is the most practical person and the only one qualified to do injections. And what your vet will do, they'll do a couple things. The most common are nerve blocking and a flexion test. Nerve blocking, your vet will put a local anesthetic into a nerve that he thinks, like around the joint that he thinks is in pain. And if your horse, once they have nerve blocks, is not in pain, then that means that that's where your horse needs the injection, because once they add that numbing agent to the joint and they suddenly are walking better, that means that they took away the pain and that's where the pain was. Your vet will also do a flexion test, where you, the owner or handler, will hold the horse and the vet will pick up one of the legs. They'll do it with all 4 legs, each at a separate time. Hold it for about 60 seconds, and then they'll have you trot off the second they put the leg down. And if you see your horse favoring the leg at all, or a certain joint, or off whenever they drop their leg, then your vet can use that to determine where the lameness is and where they're feeling sore. Vets can also sometimes just look at a horse and know that they're in pain. Some horses are very obvious when they display pain. So your vet is the number one person you want to call if you think your horse is in pain, because they can help your horse and they are the most well practiced in that. The most common place that you're going to see your horse injected is in the leg. The legs are put the most torque on, and they bear the weight of the horse, and that's where most resistance is going to happen. So that's where most commonly you'll see injections. Sometimes you can even see them in the withers or shoulders, but usually in the legs. So in summary, for a horse that works hard, competes, or uses its joint often, injections may be the key to help them if they've lost some of their synovial fluid or their cartilage in their leg and are sore. Injections can't work magic. They're not magical and they can't make your horse do things they couldn't do before. But they can bring your horse to its natural ability. If your horse is built for success, then injections can help bring your horse to that. However, the price tag on it makes people a little bit wary. And with the correct injection, a horse's performance can increase and they can become the best natural self. I hope you enjoyed my presentation. Thank you for your time.